This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan. Successful heart regeneration using metabolic enzymes. This is part 21 in a 58-part video series of the entire book. Please check out our introduction video for a background. Part 21 is under Chapter 5, Enzymes and Supplements, and the subchapter is Vitamin D3. Its value is 2. That means it's important for heart failure recovery. It is even more important if you exercise on a regular basis. The Vitamin D Council recommends a dosage of 35 units per pound of body weight. So a 100-pound person would recommend 3,500 units. A 200-pound person should be taking 7,000 units. Dosages should be combined with cod liver oil and other supplements to make certain that you don't take too much. Observations for many years have found that vitamin D deficiency is common among persons with heart failure. Many clinical trials have checked to see if vitamin D would improve survival and strength with persons with heart failure. Some of the studies have shown protective effects that have increased survival rates. Now, vitamin D works best with persons who exercise. It improves the formation of muscle fibers in the heart. So you have to be exercising the heart aerobically at least 30 minutes a day, at least 5 days a week. This effect from vitamin D3 will increase your strength quite significantly. A study conducted in Austria on persons with coronary heart disease showed that those with low vitamin D levels had a 300% greater risk of death from heart failure than those with normal levels. A German study of persons with heart failure and higher vitamin D levels had much better survival rates. This study was reported in Pediatric Cardiology. It showed that higher doses improve heart ejection fraction, which is the blood flow output from the heart. The average ejection fraction increased from 37% to 52% in just 12 weeks. 52% is just below normal, especially for persons who are over the age of 60. So this is a dramatic improvement. I mean, utterly huge improvement in output, dropping the person down several categories in class level. In 2013, the journal Congestive Heart Failure reported a study of 100 adult heart failure patients. They noted a significant increase in heart output as measured by ejection fraction. All these studies suggest that vitamin D3 is important, not absolutely critical, but very important, and is often missing and deficient in every person with heart failure. Now, there are two forms of vitamin D supplementation. There's D2 and D3. D3 is significantly more effective and stronger. An analysis of over 50 clinical studies included 94,000 test subjects. That meta-analysis found that D3 is 87% more potent than D2. D3 is readily available from vitamin and healthcare stores and suppliers. Now, checking your dosage is important because a dosage of about 35 units per pound of body weight will yield somewhere around 40 to 35 nanograms per milliliter. That's the minimum. If you take a dosage of 50 units per pound of body weight, you will start to approach the middle area of proper vitamin D levels. Your doctor can conduct a blood test using a 25-hydroxy vitamin D test. That's the correct one. You can overdose if you take too much. Over 100 nanograms per milliliter up to 200 nanograms per milliliter can be harmful. So you would have to be taking at least 3 or 4 times the recommended level in this book. Vitamin D can also be obtained through sunlight exposure, although skin can become sunburned and skin can also develop into skin cancer. Using the various types of creams with high SPFs to prevent sunburn eliminates the flow of ultraviolet light that creates vitamin D3 in the skin. So therefore, you can't put a suntan lotion and expect to have vitamin D3 from sunlight exposure. It doesn't take very long, though. Anywhere from 5, 10, or even 15 minutes of sunlight exposure is all you need to get a full daily dose of vitamin D. Persons who are obese with a body mass index above 30 typically have a vitamin D deficiency because the extra body fat captures the vitamin D generated in the skin. In summary, vitamin D3 may be an unlikely requirement for heart failure recovery, but the clinical evidence is significantly positive, somewhat dramatic in the sense that your ejection fraction goes up in just a matter of weeks, provided you are exercising the heart. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions. It's available from Apple iTunes in the iBooks edition. It's available from eBay in a print edition and directly from the publisher, Wilkerson and Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24, which includes shipping and handling. Thank you for listening.